If your dog suddenly can't walk or seems weak in their back legs, it can be really scary. It's important to know what to watch for and when to act. Hi, I'm Lyndall from Vetster, and today we're talking about why dogs may suddenly have trouble standing and walking and what you should do. We'll cover common causes, how vets diagnose and treat these issues, and when it's an emergency. As always, all of the information in this video has been carefully reviewed by leading vets to veterinarians. Alright, let's get into it.
A dog's ability to walk relies on multiple systems working together, including the nervous system, muscles, joints, heart, circulation, and even the inner ear. When something goes wrong in any of these areas, it can make movement difficult. Conditions like osteoarthritis, hip dysplasia, vestibular disease, or injuries to the legs or spine are some of the most common causes of sudden weakness or paralysis. To find out what's causing the issue, vets rely on diagnostic tests. Some conditions can be fully treated, while others may require long-term management. For chronic issues, there are often ways to minimize symptoms and help your dog stay as comfortable as possible. When a dog suddenly struggles to walk, it can show up in different ways. Some collapse completely, falling over and unable to get back up. Others seem uncoordinated, wobbling or losing their balance as they try to move. Some dogs start circling, pacing in loops instead of walking in a straight line. Weakness can make them slow, shaky, or unable to stand without effort. Limping is another sign, where they favor one leg or move unevenly. In more serious cases, paralysis can set in, leaving them unable to move or even feel one or more of their limbs. Other warning signs often show up alongside difficulty walking. A dog might drag their toes or knuckle over, showing they've lost awareness of where their feet are. Some collapse completely, lose consciousness, or even have seizures. Stiffness in the legs or joints, back pain, and trouble breathing can also happen at the same time. You might notice their eyes moving rapidly in a twitchy way, known as nystagmus, or they could lose control of their bladder or bowels. If your dog suddenly can't walk and is showing any of these symptoms, it's an emergency. They need to see a vet right away. Sudden hind leg weakness can happen for a lot of reasons. Issues with the nervous system, muscles and joints, heart and circulation, or even the inner ear can all impact a dog's ability to stand and walk. Some may just seem unsteady, while others might collapse, drag their legs, or lose all movement in their hind end. Since so many conditions and injuries can cause this, figuring out the cause quickly is crucial. Traumatic injuries are a major cause of sudden paralysis, limping, or weakness in one or more legs. A dog might be hit by a car, jump, or be thrown from a moving vehicle, or be involved in an accident while inside a car. Attacks from larger animals, falls from high places, or even being accidentally hit by sports equipment like bats or balls can also cause serious damage. Some dogs get injured by being stepped on, caught indoors, or other accidents while underfoot. Even minor injuries can damage the spine, spinal cord, muscles, bones, or nerves. More severe trauma, especially to the head or chest, can cause additional complications. Depending on the injury, one or multiple limbs may be affected. Toxins are another possible cause. Many household items and foods are dangerous to dogs if ingested. Cannabis can lead to disorientation and trouble walking. Xylitol, found in sugar-free gum and some peanut butters, can cause a dangerous drop in blood sugar. Macadamia nuts are toxic and often cause back leg weakness. Herbicides, pesticides, and certain flea and tick treatments can also trigger neurological symptoms. One of the most dangerous substances is antifreeze, which can quickly become fatal if not treated immediately. If a dog is weak or struggling to walk, and you suspect they've gotten into something toxic, they need emergency care. The best way to prevent poisoning is to keep medications, chemicals, and toxic foods out of reach. Having a list of harmful foods on hand can be a helpful reminder of what's off limits. If you think your dog may have eaten something toxic, don't wait for symptoms. Getting them to a vet right away gives them the best chance of a full recovery. Neurologic conditions can also affect balance, coordination, and movement. When the brain, spinal cord, or nerves are involved, dogs may struggle to walk, stand, or even stay upright. Some of the most common neurologic issues that cause ataxia or paralysis include intervertebral disc disease, degenerative myelopathy, and myasthenia gravis. Other conditions, like cauda equina syndrome, spinal or brain tumors, meningitis, and coonhound paralysis, can also impact mobility. In some cases, a stroke can lead to sudden weakness or loss of coordination. Because many of these conditions worsen over time, early diagnosis and treatment can make a big difference. Intervertebral disc disease, or IVDD, is one of the most common causes of sudden back leg weakness. It's especially common in long-bodied breeds like Toxins and Corgis. While some neurologic conditions develop gradually, their early signs can be subtle. If those warning signs go unnoticed, it may seem like the issue appeared out of nowhere, when in reality, it had been progressing over time. Neurologic conditions don't always just affect the hind legs. Depending on the issue, paralysis or weakness can show up in other parts of the body as well. Recognizing symptoms early and getting a vet involved quickly can make a big difference in treatment and recovery. Because so many different conditions can affect a dog's ability to stand or walk, vets rely on thorough exams and diagnostic tests. They'll start with a physical and neurologic exam, and may recommend imaging like X-rays, ultrasounds, CT scans, or MRIs. Blood tests, urinalysis, and an EKG can help check for infections, organ problems, or heart disease. Some cases may require a spinal tap or more specialized testing. Once the cause is identified, treatment depends on the condition. Some cases require emergency hospitalization, IV fluids, surgery, or blood transfusions, while others may improve with rest and supportive care. Some conditions can be cured, while others lead to permanent mobility issues. Even in those cases, many dogs live happy lives with the right care, physical therapy, or mobility aids like wheelchairs. If you're worried about your dog's mobility and need expert advice, Vetster makes it easy to connect with a licensed veterinarian online from the comfort of your home. Whether it's an urgent question or ongoing care, a virtual vet appointment can give you the answers you need. Visit vetster.com to book an appointment today. Thanks for watching. If you found this video helpful, hit the like button and subscribe for more pet health tips. See you in the next one.